Hello everyone, and welcome back to Flo's Corner. So in this video, I'm going to be discussing what could go wrong before, during, or after a blood draw. So if you're new here, my name is Flo. I am a certified phlebotomist and I do make phlebotomy videos. I am in no way, form, shape, or fashion a actual professional, but I am a certified phlebotomist, and anything that I decide to disclose on my page is normally through my experience of being a certified phlebotomist. I also work on all age and demographics from neonates all the way to geriatrics. So without further ado, let's get right into it. So here I got my notes. So if y'all see me looking down, I'm looking at my notes. So this one can be literally before, during, or after a blood draw, and that is a patient fainting. Now, blood draws are not for everyone. Some people are afraid of needles, some people are afraid of blood, some people are afraid of both of them. Seeing the needle, getting their blood can cause any type of anxiousness or anxiety that may tend to make the patient uneasy and have an uneasy feeling, whether they're walking into your room or they just know prior to coming into your room that they are about to have their blood drawn. We mostly are told that mainly children are the ones to really give you such a hard time, but there are other age demographics out there that do not like their blood drawn. I've had adults pass out on me. It does happen. I've had geriatrics pass out on me. So this is something that could go wrong in a blood draw. It's not the end of the world for you as a phlebotomist. Sometimes patients come into your room letting you know that they're afraid or that they're nervous, or some of them even have said that they tend to pass out. It is up to you as a phlebotomist and your discretion on how would you like to handle this patient. So normally if I have a patient that ever walks in and tells me that they just get very uneasy or they get very woozy, or some of them even tell you I don't like to look at it. So I just like to offer, would you like for me to speak to you through it? Before I, once I'm cleaning, and then once I'm getting ready to stick the needle, some I'll ask if they want me to be verbal with them. Some will say yeah, most of them will say yeah, but then some of them will say no and just say, just do it. And just, turn the head, just go ahead. Don't tell me anything. Don't talk to me. They just find their own way on how to cope when they know they are getting ready to get their blood drawn. Some may be vocal about the symptoms that they are feeling. Some will say, I'm feeling dizzy, or I'm feeling really hot. Some may say, I'm feeling kind of nauseated and stuff. These are just certain signs of someone may be entitled to pass out. These are just certain symptoms that you as a phlebotomist should know that they may be on the verge of passing out. If they're telling you they're feeling nauseated, they're feeling very warm, very dizzy, they're kind of sweating, all of these signs you have to really look out for, because you know that it's getting ready to get serious. Now, if they tell you this prior, then obviously you would never just draw them if they're feeling that way. You kind of make sure the patient is okay and the patient is okay for this blood draw. This can also happen while you're already in the vein with your needle. I've had patients pass out on me while I was already drawing the patient, and pretty much, of course, do your same procedure, remove everything, take the needle out, take everything off of the patient, try to get them alert again. Never leave your patient alone if they have passed out. You can lay your patient flat and make sure that their legs are raised. Try to make sure that they are alert. When they are alert, you can offer them water. You can offer maybe fanning them or however. Never let your patient just walk out from fainting. Make sure they are really fully alert, that they are speaking to you, that they are aware of where they are. And at that moment when they are alert, you should be already calling your supervisor, letting them know what happened. You're going to have to fill out an accident report because of what happened, and that's just to have your back. Now, normally once you call your supervisor, then they can figure out what you should do with the patient, whether you didn't finish drawing the blood because they had passed out before you were finished with all your tubes. They will give you the go on what to do after. But a patient fainting can happen before, during, and even after a blood draw. But you are just supposed to already at least have these little motions that you learned in your phlebotomy course on what to do when a patient faints. So normally when a patient is getting ready to pass out or do pass out, this is normally known as a vasovagal syncope reaction, which is normally the heart rate and the blood pressure tends to go low. You'll see the symptoms like nausea, sweating, feeling hot, feeling very warm, or sweating. This is pretty much like their nervous system is really going into overdrive. It normally is like, sometimes some people call it like an anxiety attack, or maybe sometimes like a panic attack. You may have a vasovagal syncope reaction, any type of like feelings of pain, stress, anything like that. And this can also be a factor of the patient getting ready to faint or has fainted and things like that. So that was just, you know, a little bit of what I've learned in the textbooks of what pretty much that was about. The second thing of what can go wrong during a blood draw is a heart stick. If you haven't checked out my heart stick video, I'll definitely link that in the description box below. Definitely check that out, because I also teach how to fix a heart stick, or how to get a successful complete blood draw with someone who is considered a heart stick. So just in layman terms, a heart stick is someone where you really can't find the veins. They have very small or deep veins, may have rolling veins, collapsing veins. These are people who are normally considered a heart stick. Also someone that you might have stuck more than twice and you couldn't find a vein. Heart sticks are very common among a lot of people. There are a lot of factors that make people heart sticks. Most heart sticks, the number one thing would be like dehydration. I've noticed that a lot being a phlebotomist, that when I ask my patient, as soon as they come in, obviously verify your name and date of birth, I always have you had anything to eat or drink today? And I do have patients that say no. So I would say, when's the last time you had something? And they'll say like, oh, last night. I'm like, it's like 9-10 hours later and you haven't had anything. So you do have a lot of dehydrated patients, which doesn't really help that much with a blood draw, because if you don't just really have that really big juicy vein sitting there somewhere, it's gonna make your veins kind of hide away. They don't want to come up. Because your body's not hydrated. So that mainly can be a heart stick. Then you have other factors, like some people just have really not good veins. Some just have scar tissue. Some have really small veins, really deep veins. It's just hard to really just kind of descend. No matter how tight you turn that tourniquet, no matter how many times you try to palpate the vein, sometimes the person is just a heart stick. It happens. I don't want to go into too much detail about the heart sticks, because I do have a wonderful video. Like I said, I'm going to leave it in the description box below, so you can at least go check that out. And I go through a whole line on what to do with the heart stick and how to actually draw your heart stick's blood, or other factors that you can use to help this heart stick so you can get a successful blood draw. But I definitely don't want to waste this video on that. But heart sticks was a number 2 on what I had on the list for this. Our third topic on what can go wrong is a blown vein. So a blown vein is literally just a ruptured vein. It is something that happened with the needle that damaged the vein during the blood draw process. So this is considered during a blood draw process, obviously, because we're only going to stick during the blood draw. So with a blown vein, the needle had pierced the vein and damaged it in some way, which caused the blood to leak into the tissue around the surrounding area. So most of the time with a blown vein, a lot of times your patient is going to complain of pain, more like a stinging sensation. It's not going to feel very pleasant. You're going to naturally see that sometimes with a blown vein, you're going to see that the skin starts to puff up real bad at the insertion site. I know this is very vivid, but it does. It looks like a little balloon. It's like puffing up. It does blow up. It will blow up, and normally it'll just turn into a collapsing vein. So most of the time, blown veins will just turn into a collapsing vein. You do not, as a phlebotomist, want to continue to try and get this blood draw when you see that bubble, because you knew right there that your vein got blown. It's blown away, it's gone, it's done, that's it. Take the tourniquet off and remove immediately. So with the blown vein, your patient is going to have some swelling. They're going to have some bruising. It's not going to look like a pretty sight with a blown vein has just taken place. So the best thing to do is to bandage them up here. It's not, like I said, it's not going to be pretty. You are more than welcome to always call your supervisor and let them know what you've done. If you want to make your patient comfortable and educate them a little bit about what happened, let them know what happened with the blown vein. And you can say, the cold pack, you can put that on for the first 24 hours. And then after that, you can put on a warm compress. So you pretty much want to educate your patient. It is blood around the surrounding area, but it's going to reabsorb back into the body, maybe a week or so later. Now, you can also educate them that if they find that they're having pus or extreme swelling or any type of excruciating pain, things of that nature, maybe having a fever, definitely educate them, to tell them to well, not educate them, but instruct them to go to the hospital, because that's not normal, and then something is definitely wrong. But you're gonna have to do an accident report anyway, so definitely cover your back. Write the accident report. Make sure you told your supervisor, oh my God, I was drawing and it was a blown vein. I, messed up this patient's arm or however. And like I said, get the instructions on what to do after that after that moment and however. So the blown veins are going to turn into a collapsed vein, and that means that the blood flow is going to stop. So the worst thing that you can do is sit there and fish, because you already blown the vein out. There's not going to get any type of suction or anything like that. So you might as well just start all over again on another arm, because that one's messed up. So this one will be considered after a blood draw, and these are hematomas that developed after your patient's blood draw. It's never not uncommon for people to see someone who's gotten stuck for a blood draw, and you've noticed that you or maybe a friend of yours or a family member has gotten some bruising. Sometimes you can see it, you're like, oh wow, you're really black and blue there, so purple. There's some that the whole arm has a hematoma. These are what they're called. I know we call them bruises, but there's a specific name for them, and they're hematomas. Now, hematomas is not just something that happens during a blood draw. You can have hematomas from anything. You could have fell off of your roof. You could have fell off of a bike and you could develop a hematoma. But I'm just going to talk about the hematomas that come with blood draws. Most of the time, hematomas are normally just damage to the blood vessels. It's like a collection of blood that kind of surrounds the blood vessel, which gives you that color that we're used to, the black and blue, purple, brown, however you want to call it, that ugly color on our skin after a blood draw. Now, it's not always the medical professional's fault on why someone had developed a hematoma. Some people can actually be prone to hematomas because they just have very fragile skin. Some, just the slightest little puncture or even a vaccination, certain needles or however can really just give someone a hematoma, just depending on how their skin is. So in my geriatric patients, the older we get, the more that our tissue starts to diminish a little bit. So they tend to have more hematomas. Not, like I said, the medical professional's fault. It's just the way of how fragile the skin can really be. It does happen to a lot of different people. And on the other hand, it may be because of a medical professional. Sometimes when you don't apply enough pressure, when you remove your needle, that can cause a hematoma. Wrong needle size can definitely cause a hematoma. So if you have like a very small vein and you decide to use a 21 gauge, something bigger, and you try to get that vein, that can cause a hematoma because the needle was just too bigger than the vein. So that's not good either. Sometimes the wrong angle. Definitely check out my video on Blood Draws 101. I definitely describe the angle, insertion angles for your needles, whether you're using a straight or whether you're using a butterfly. Like I said, certain ways you're not supposed to draw blood. You're not supposed to draw, on a vertical way, because that's almost like, getting your blood drawn like that. No, everything is at a 30-degree angle. Also fishing, like if you're in the vein and you missed it, so you're trying to find it. Like I said, you're not supposed to do the fishing. You can reposition, but never fish inside of the arm. Hematomas can also be caused by inserting the needle too far, so you actually went outside of the vein, and that can cause a hematoma as well. You can also not insert enough into the vein. So sometimes, like when you're like at the cusp of the vein with the needle, that can cause a hematoma because the blood is just not very flowing freely. You're not in the vein completely getting that full blood draw, and that can cause a hematoma as well. It also cause a hematoma and also a blown vein if you remove the needle before you remove the tourniquet. You will start to see that blood is just flowing. It's just flowing because the tourniquet is still applying all that pressure. So you never want to remove your needle first before you take off your tourniquet. Really add that pressure after you remove your needle, because you need to close up that vein. You need to have the blood to stop flowing. Like I do see some patients that whenever you say, apply pressure while you're like trying to get the tape or whatever, it just depends on how you are drawing. And I see them, they don't put any pressure. They'll, and I'm like, like put pressure onto it. You need to hold it, like close it. It's the same way as if someone was to get a gash or anything. You have to apply pressure to the site to stop the bleeding. But I do have my patients that just, you know, it's real light, real soft, and I'm like, you know, now come on now, you know. I'm just saying that's definitely also another way that can also develop a hematoma, because you're not applying the adequate amount of pressure. Hematomas never look all that great. A lot of people look at them and think they're very excruciating, serious, and oh my God, I'm gonna, whew, yeah, no. It looks worse than what it really is. Most of the time, hematomas go away on their own. Your body will reabsorb that and then it'll go right away. It just looks ugly. That's pretty much what it is. It just looks discolored, you know. You're like, I'm this skin tone. Look at this ugly old bruise looking thing on my arm, on my hand. But literally, like I said, it just takes some time. It's almost like a bruise. It's going to take some time, you know, for the body to reabsorb it, and then it'll go away. You'll be back to your regular color. Like I said, with like the blown vein, if you feel like there's pus, or you know, it's just very swollen, you're in like really in dire pain, your whole arm turned that color in your hand, and yeah, then you could obviously need to go to the medical emergency room, because yes, something's wrong. And also, you can apply your cold compress in the first 24 hours, and then after that you can apply the warm compress 20 minutes normally between the both. So if you're using the cold one for the first 24 hours, maybe about 20 to 30 minutes, and then the warm compress 20 to 30 minutes. So another thing that can go wrong, this is going to be an after, and that's an infection. You can have a patient that develop a terrible infection, whether a bacterial or a fungal infection, from a blood draw. It all boils down to poor infection control. This is why it is crucial to wash your hands. This is why it's crucial to change your gloves. Definitely never use the same needle. I don't care if it's on the same patient. Never use the same needle. You have to develop these infection control procedures, which is also your sanitary procedures, because an infection after a blood draw is very serious, and that should never be something, as you as a phlebotomist, and you were the last one to see that patient, and that's what happened to them. It can be from blood draws if you didn't use an alcohol swab and you decided to just insert the needle without cleaning the area, sanitizing the area first and sterilizing the area first. Never draw any patients without using your gloves. I have seen in the past, before I was even a phlebotomist, I've even gotten drawn once when I was in my teenage years from a phlebotomist that didn't have any gloves on. We're taught that once we use the alcohol swab, we do not blow at it, we do not fan it, we let it air dry on its own. And I've seen that in my years of being a human being throughout my life, before I even knew what procedures and things were, you know. So that was just one of those things where I saw someone do that. And when I used to get my blood drawn back in the day, you know, they're wiping you know, these things. As a phlebotomist now, obviously I know that that was not the right procedures that they should have been performed. Needles, reusable needles, will definitely give infections around the insertion site, and that can definitely be super painful for any patient dealing with something like that. So definitely always follow your safety guidelines, your sanitizing guidelines, your infection control guidelines, everything like that. So another thing that can happen after a blood draw is the blood samples being contaminated in some way. So one thing is hemolysis, which just means the destruction of the red blood cells, which is what's needed in a lot of laboratory testing. Everything may have gone well. You may have had a great day, a great patients, barely any heart sticks. If you had a heart stick, you did fine with it. You were able to completely successfully draw from them, and however. But then you get a call the next day that the specimen, something was wrong. This is something that can happen, that can go wrong after a blood draw. So one cause of hemolysis is the mishandling of the blood specimen during the collection. Now, sometimes you might have missed the vein, or you went too far into the vein, and sometimes it brings like those little, I call them the little bubbles. They look like little bubbles because of the suction. You may have that problem. Sometimes it can happen also if a tube was messed up, vacuum seal went away on a tube. That can also mess up with mishandling the blood specimen during the collection. It can be anything of that nature. It could have happened because the wrong needle size. It could have happened because of bubbles, like I said, that got into the tube. Also, if you was to draw from a hematoma, I know it sounds crazy because you would think, how on planet Earth would a phlebotomist draw from a hematoma? You never know. Honestly, you never know what anyone can do. They may have been able to never find a vein, but it doesn't mean that you would draw from that site, but it does happen. I'm not going to lie. And that can also cause hemolysis because it's a hematoma for a reason. Something was wrong, and why would anyone want to redraw from that certain vein? Also, it can happen through transport. Sometimes if you have the refrigerated specimens and then you have your room temperature specimens, sometimes anything can happen where the room temperature specimens were in the box with the refrigerated specimens, and vice versa. The refrigerated ones winded up in the room temperature, or your frozen ones melted or anything like that. That can also cause hemolysis as well. That can also give inaccurate results because the specimens were not handled correctly. Also, hemolysis can happen from not enough blood. Certain tubes have an actual little line on the tube which shows how much blood is needed for the certain test, and obviously, if you didn't fill it to that line, then you can cause hemolysis in the specimen, and also inaccurate results once again, and the patient may be a redraw after that. You can also cause hemolysis by the alcohol still being on the arm when you was getting ready to insert. This happens a lot sometimes, like you have to let the little area dry after you sanitize the area, but there are phlebotomists and other medical professionals that they'll just put it on and just stick, and that can cause hemolysis because you're diluting the blood specimen because the alcohol swab was still there while you're trying to insert. So like I said, to not make that a problem, do not stick until the alcohol prep pad solution has firmly dry. Also, labeling your specimens incorrectly, not putting the right patient on the tubes of the specimens can also something that can go wrong after a blood draw. And just another honorable mention, bleeding after a blood draw because your patient is taking an anticoagulant medication, which is like a blood thinner. Things like that can happen when even after you apply the gauze, after removing the needle, the patient still was bleeding. But that's just because, like I said, they're just on a blood thinner. So that just means that you just have to hold it just a little bit longer, or you can bandage your patient up with Coban instead. Just make sure that the patient has completely stopped bleeding before you decide to exit them out of your room. Another honorable mention is the latex allergy. Some patients may have a latex allergy, but since I've been working as a phlebotomist, whether I was in the hospital or a clinic, they have been doing very well with not doing the latex gloves anymore, which is awesome for everyone who's not. There are patients that will walk into your room and say, I'm allergic to latex, and I will gladly tell them that these are not latex gloves. And if I do feel, and I will also show them the box as well, just so that it can give them some type of comfort. But that is something that could go wrong. But like I said, the new times now, you barely see really latex gloves like that. Quick tip I have to really not have these things happen to you as a phlebotomist is to educate your patients. Make sure that you do tell them when getting blood draws that they should drink plenty of water. If you need to explain, it just tells them that it increased the blood volumes, which makes your veins more apparent so that you can see them. Also, make sure to have the right needle size. Make sure that you are doing the blood draws with the right angle. If you do not feel a vein, do not blindly stick, which means that you think it's there and it's not. Sometimes veins may look like that on the patient's arm, but that doesn't mean that that's a good vein, and it can blow and it can turn into a hematoma. Just because you saw it, you always got to make sure you feel it. That's always the main thing. Make sure you feel your veins. Don't blindly stick, because then we wouldn't be here with this list. Any questions you have, always consult with your supervisor. You can ask any other phlebotomist. If you're working with another phlebotomist, if you feel a vein and anything like that, but never just feel, like I said in most of my videos, is never feel unsure. As a phlebotomist, you need to be sure and 100% in what you're doing, because these are people's lives that we have in our hands, and we don't want to destroy anything that they got going on. You don't want to give people blown veins. You don't want to give people hematomas that could turn really bad and really worse for them. Making anyone feel uncomfortable or anything of that nature. Definitely, like I said, you're a phlebotomist. Be sure, be confident in yourself. You got this. If there's anything you'd like to add to this video, you can definitely put it in the comments down below. Like I said, I'm always open to any type of criticism, any type of encouraging words, you name it. I'm here to speak on my experience, but I'm also here to listen to what you guys got to say. But I really hope that this video was helpful. These are just certain ones that I decided to put and condense in together. Obviously, there can be way more in your phlebotomy journey or career. And like I said, you got this. And I hope to see you all in my next video. Bye.